Bonnie Henry is here. She's the Provincial Health Officer for British Columbia. Welcome, Dr. Henry.
Thank you for having me.
I'm Paul Wells. I'm the senior writer. I'm a senior writer at Maclean's magazine. We got a million of them. And this is Maclean's in Conversation. As always, we're brought to you by the Canadian Bankers Association, our sponsors since we first started bringing these conversations to you 3 years ago, and we're always grateful for that. And Dr. Henry's awful busy. She doesn't have a lot of time, so we're going to get right into it. People have been saying for a year that nobody could have seen what we're going through coming, and yet you kind of did. You wrote a book in 2009 which described a major viral outbreak in considerable detail. You've spent your career getting ready for this moment. How has the past year compared? We'll start with the big question, then get into more detail. How has the past year compared to what you always thought was going to happen?
I'm not sure if it's thought or in a sense, dreaded. As you say, I've been working on the issues of pandemics and the potential of pandemics for a long time as part of my sort of coming up in public health. And as a matter of fact, I chair the Canadian Pandemic Influenza Planning Committee and have done for a number of years that developed our Canadian Pandemic Influenza Plan. Which is the basis for what we use for our response for this pandemic. I think it's a combination of understanding that these new viruses in particular, but other things that can cause pandemics as well, bacteria, were out there, were coming, and that it was, in a sense, an inevitable part of our relationship with the environment and with animals and others around us, that we were going to see the arising of new microbes that can cause this type of a pandemic. I don't think that deep in my heart I recognize that I really believed we would get into such a global impact of the pandemic like we have seen in this past year.
In hindsight, it's quite easy to show moments early in the rise of the pandemic, late February, early March of last year, when public authorities could have done something different that now, in hindsight, maybe they should have. Do you find yourself second guessing those early days of the pandemic in Canada?
Yeah, you know, I'm not sure second guessing. We did the best with what we had available at the time. I haven't actually had a lot of time to second guess much of it yet, but I do think we missed an opportunity globally to actually coalesce behind China and try and recognize and stop things in their tracks. But that, again, is a bit in hindsight. I think we did recognize early, and part of that was my own post-traumatic stress, I guess, from dealing with things like SARS and the pandemic that we had of influenza in 2009. Recognizing early on that we were likely to be affected by this, and to try and marshal our resources to make sure that we had our public health systems in place, that we had some backup in our healthcare system to be able to weather some of the storm. But the challenges that we faced around the globalization of our supply systems, those were even little things like the swabs that we used to take a nasopharyngeal swab for the test for COVID. The fact that those are mostly manufactured in other parts of the world and they leave in short supply, and all of these details about how we are globally connected were things that really came up over time. But of course, it's always easy to look back and say we should have known. And yes, in many ways we did predict or were planning for this type of a scenario to arise. But you never know what storm you're going to be in until it arrives. And I think we did our best to try and weather that as we as new things came and as we learned. We have learned a tremendous amount of it this past year.
Okay. There's also been a lot of reporting that suggests that essentially, during the time between 2009 and 2020, public officials were sorely tempted to take their eye off the ball. There's always a current, actual, pressing emergency that is easier to focus on than a potential eventual emergency. What's your take on that reporting? A lot of it from the Globe and Mail, that essentially the Public Health Agency of Canada was progressively disarmed by successive governments.
And I do believe that some of that is true, absolutely. And I've been on record, as have my predecessor and many others in public health, of expressing our concerns about the role of the Chief Public Health Officer of Canada and how that was marginalized after the influenza pandemic in 2009, and our challenges in support for the Public Health Agency and the role that they play in helping us coordinate across provinces and territories, a really important role. And it has been weakened and whittled away by successive governments. That is absolutely something that I think we're still trying to overcome. And I think if there's any positive thing, it shows the importance of the role that my colleagues play across the country and the public health system plays. And public health is about prevention, it's about mitigation and preparedness, and those things are very challenging when you're competing, as you say, with the tyranny of the urgent. What needs to be done today in our healthcare system and the acute care system in particular. And we've seen that as well with long-term care, and this outbreak has, if anything, exposed things that in public health we've been talking about for years, about risks and challenges in long-term care that make our seniors and elders so vulnerable to something like a pandemic. So yes, it's very challenging. We've done a number of things in Canada over the years around our pandemic stockpile. It costs a lot of money to maintain a pandemic stockpile, and those are not always priority when we have many other things stretching our healthcare budgets. There are challenges around our information systems. We had, after the SARS outbreak in Toronto, we had an attempt to develop a pan-Canadian public health information system, which became known as Panorama. But the federal government, the Public Health Agency, opted out of that early on. So we do not have a single system that allows us to provide information seamlessly across the country and to the federal government. This is something that we've been pushing on, trying to work on for a long time. But when things are looking good, it's very challenging to make the case that we need to spend time and effort and money. And we also, in public health, we are very thin on the ground. Redundancy in a public health system is seen as waste in many ways. So, if you were a bank and you didn't have a backup system for your IT systems, that would be considered malpractice. But in healthcare, and particularly in public health, we're one deep. We don't have that backup. We don't have the people that we need to be able to deal with the crises on top of our day-to-day work, and that has really shown us, shown in the last year as well.
One would think that governments and citizens had learned their lesson over the past year, and yet I know that at the Federal Public Health Agency, there are people who are trying to figure out how to get off a war set footing, power down for the interim period, and yet maintain preparedness for the next time. Is that a concern of yours too?
I always worry that we talk about lessons that we've learned, but we don't always have that memory that allows us to implement the things that we know. Because many of these things have been what we learned after the SARS outbreak in 2003, and we made some incremental important changes. We beefed up some of our infection prevention and control liaison and the work that we do between public health and acute care and long-term care. We had a better understanding of the use of masks and respirators and gloves and gowns and all of the infection control pieces that we need in our acute care and healthcare system. Um, but we lost a lot of the important pieces around communication and data and the systems that allow us to seamlessly share information across a very broad, we're geographically and demographically a huge country. But so we lost a lot of those learnings that we had from before, and it's a very small voice of us who were putting that attention, trying to put that attention. And some of the things that we are now learning, we have in public health been concerned for years that we've lost our ability to produce vaccines in Canada, and that has become a real challenge for us. We had a vaccine manufacturer that made influenza vaccines for us up until after 2009, and I think in some ways the influenza pandemic in 2009, we were probably helped us develop a bit of complacency that we know how to deal with this, that it wasn't as severe as it could have been. We had vaccine available, it was very effective, it worked quickly, things came together, and then there was a sense of, okay, we've got this, where it's not as bad as those people. It'll never be as bad as what some of us have saying could be, and the potential that could happen. And now we need to not forget that there has been inequities exposed in communities, among racialized communities, amongst our Indigenous people in Canada. We need to build back in a way that is more just, and that focuses on that safety net that we have. And part of that, of course, my perspective is from a public health perspective. We need to have a coordinated, cohesive public health system that supports us to be able to manage what is going to come next for us.
Now, I want to ask about the situation currently in British Columbia. There's been a recent rise in the number of cases, and there has been the appearance, especially in schools in Surrey, of the okay, I can't find the fancy name for it, but the variant of concern that comes from the UK, which spreads more easily and is and could get out of hand. How concerned are you about these developments?
Obviously very concerned. We're at that, and I've said this a few times, we're in that sort of challenging place of vaccine hope and pandemic reality. And the pandemic reality we're dealing with in BC and across the country is that we are having introductions of these variants of concern, particularly the variant from the UK. They are being shown to be more infectious, so more easily transmitted between people. We saw that in the UK and Ireland and Portugal and other places, seeing it in Ontario. So we are watching very, very carefully. But then it goes back again to the core public health work that we do in finding people, in contact tracing, we call it. So both backwards contact tracing, trying to figure out where people became infected and who they are passing it on to. So we are, once again, relying on our public health people to identify people, and we are focusing more attention on people with these variants of concern, making sure that their close contacts are tested, that we're able to effectively support them to isolate. And these are not easy things. We, as many people now have known across the country, quarantine and isolation are challenging for people, for families, for individuals, and we need to support them in doing that, and that's part of our role in public health. And I will say about Surrey, it's not that we've had a whole cluster of people transmitting in schools at all. What we have is we've been doing increased surveillance, these variants of concern, and testing. Now close to 100% of the new positive cases are screened to see if they have some of the concerning mutations. And what happened was a number of them were identified at the same time, but many of them were people who were infected that we knew were cases from the past couple of weeks. So we are paying extra attention and doing extra testing, but so far we have not. These are exposures, they're not transmissions in schools, and the testing is showing us that to date, there's very little transmission, and that means that our what we have in place in our schools is working, and that is reassuring as well.
So I've heard in recent days from a lot of parents in British Columbia who have a lot of questions about the policies in place. One of them is around masking. No child in British Columbia is required to wear a mask in elementary school, and in middle school and high school, not at their desk, which is where they spend most of the day. I got to say, speaking as an Ontarian, there's a stark difference between that policy and the policy we have here, which is that in public schools, everyone wears masks all day long. Are you tempted to revisit that policy?
Not at all. We have said from the very beginning that masks are only one part of the safety plans that we have in our schools. It's all about, we have cohorts, we have a number of different safety measures in place. And the guidance that we provide in public health is the baseline that the schools work with. And then each school looks at, with the principals, the parent-teacher associations, the teachers themselves are involved in developing the safety plan for that school along with their local school health officer. So, masks are not the silver bullet that's going to solve all these problems. And what we have seen is that when the safety plans are in place in the schools, and they work, and where we have seen transmission and the very limited transmission events that we've had, it has been when some of those safety measures have not been in place. And I think it's very important across the country, and we're seeing this in other places too, that most of the transmission in schools is with the adults in the school system. So we need to make sure that we're supporting them to do what they need to do as well. And there's no evidence that a young child having to wear a mask all day long is going to make a difference in terms of transmission. And these are things that are important for us to encourage and support young children in particular to wear masks and to wear them appropriately and safely. But that is something that is a culture within the classroom, but also in families. And we need to recognize that there are many people, particularly young children, who it's a challenge for them to sit all day long with a mask on.
Okay. The Centers for Disease Control in the United States suggests that masks don't make sense for kids under 2 years old, and that correct mask wearing may be difficult for kids under grade 3, but that leaves grade 3 through grade 12 as potential really good cohorts for mask use. And yet you don't seem to agree with the Centers for Disease Control.
Not at all. I absolutely agree with them. And we've said the same thing. We've used, and Quebec and others have used, is under age 12, because that's where we see a difference in terms of transmission of the virus, as well as young people's ability to adhere to some of these. And absolutely, some kids are really good at it, and it doesn't faze them at all. Other children are not able to do that. And we believe that it is up to the family and the schools to create that environment that enables children, but not to penalize or shame children if they have challenges wearing masks.
Okay. David Fisman at the University of Toronto, colleague of yours, and I believe an old acquaintance, says that the reproduction rate in British Columbia is now the highest in Canada. What's driving that?
Yeah, and that's interesting because the reproduction rate is an average, right? And when we break it down by different areas of the province, it varies by what's happening in different parts of the province. So it is a concern for us. And right now we've seen an uptick. We were consistently below 1 for the last number of weeks, although the last 2 weeks we've seen an uptick in the most highly populous area of the province in Fraser and Vancouver Coastal, so the lower mainland, the Metro Vancouver area. And what is driving that is two things. One is social connections in the community, and we're still seeing some of that happening, and there's impacts of that. Recently we've had a pub that, against orders, had an event that led to transmission, that led to closing of a daycare, our first outbreak in a daycare in that region. A transmission in a school between 2 adults in a school, and several hundred people becoming infected with the virus. These are the things that are leading to some of the transmission. And the other thing that we're seeing is there's transmission in a number of the essential workplaces. So we spent quite a lot of time working with our WorkSafe, our workplace health folk, and our environmental health officers to come up with COVID safety plans. So that is the basis of how we're responding, or how businesses and organizations have in British Columbia. And we are holding people to these plans, and they're publicly available for people. And it is very challenging for some of our essential businesses, and we're targeting the areas where we're seeing transmission happening. So it is concerning, absolutely. And we're concerned, of course, about the fact that we may be seeing variants involved in this, though for the most part, the clusters and outbreaks we're seeing, and we're doing whole genome sequencing, aren't related to variant spread yet. We're working on that for sure. And this is the time, I think the other part that you have to know in British Columbia is that we haven't had those lockdowns, if you will, in the same way that they have in many other parts of the country. We have all of our retail stores open. We have restaurants open with very strict restrictions on how they can operate. And these COVID safety plans are the basis for how we're trying to keep things going, because you know, the other things that we have learned and that we've been paying attention to here in BC a lot is what we call the societal impacts of the measures that we've taken. We learned in March and April last year how stressful and negatively impact families and children were when schools were closed. And so we have put a priority and a focus on keeping schools open so that children can learn and grow the way they need to. We know that if that doesn't happen, there are generational impacts on those young people. So that's been a focus. Focused on keeping workplaces open. We know that the impacts on closing even retail stores, for example, and some of the broad restaurants differentially impacts younger people, people who are lower income, and also women and racialized populations. So we've been trying to balance that, controlling the spread of the disease in the community and making sure we can support people to do what they need to do in their work life. And of course, the other major important thing is keeping our healthcare system functioning so we can provide care to everybody.
And one last aspect of total public health in British Columbia, which I would not want to have you on and not ask you about, which is the opioid overdose crisis, which has been a pressing concern for 5 or 6 years now, and which got worse last year. Is there anything you can do about that while this pandemic is raging, or is that just going to have to wait until later?
Yeah, you know what? We are trying to do what we can. It was disheartening, very, very hard for us in public health, been focusing on the overdose crises for so long, to recognize that the impacts of the measures that we put in place to deal with the pandemic exacerbated the problems in ways that we didn't imagine. It ranged from, you know, the shelters needing to decant people, not having the space to be able to support people. That's led to encampments in our communities, and we've been working on supporting people who are in those encampments. But the other important thing that we've seen is that the measures to support people through the pandemic has meant that social isolation for people who use drugs, and not necessarily people who are homeless or underhoused, but people who are would normally be at work and functioning and using drugs as part of their life. They're now not connecting to people, they're not being seen, and they're dying at home, particularly young men. And the toxicity of the drug supply has just gone up algorithmically because of things like border controls and difficulty getting drugs in, and how they are now being imported into the country or developed, created here and mixed and contaminated. So those challenges have made that crises even worse than we could have imagined. And yes, we are continuing to work on those. We've done things like enabled safe supply to be available much more broadly in many different parts of our community, so people are able to access pharmaceutical alternatives to street drugs. They're able to be prescribed that by now RNs and licensed practical nurses under an order that we put in. We've been working with the government around decriminalization. It's not a single thing that's going to make a difference, but all of these pieces together are going to help us hopefully get out of that crisis as well.
Okay. I know you're quite busy and that you had limited time to talk to us. You've been very generous with giving us the time you had. And so I want to thank you, Bonnie Henry, the Provincial Health Officer for British Columbia. Thanks for joining us today. And I'm Paul Wells, Senior Writer for Maclean's Magazine. Thanks for joining us. And thanks, as always, to our sponsors at the Canadian Bankers Association for helping bring you these conversations. We'll see you again soon.